I'm a assistant professor of speech-language pathology at Concordia University and a PhD student at Northern Illinois University. And this was a look at, a qualitative look at cue-based feeding with preterm infants. As we know, preterm infants require additional support for that transition to independent and self-regulated feeding and additional support for just their general feeding skill development. Preterm infants are at risk for feeding difficulties, prolonged length of stay in the NICU, and compromised growth. The transition from volume-driven feeding protocols to cue-based feeding has been gradual and remains inconsistent. And so the aims of this study were then to obtain nursing perspectives on the implementation of cue-based feeding protocols, parent education, and feeding outcomes. And by understanding these components, we can work on improving our education and ultimately our outcomes for those babies. So participants included a nursing supervisor and clinical nurse specialists from two different level 3 NICUs, but all of them were former direct care nurses in the NICU with years of experience feeding preterm infants. Semi-structured interviews were conducted with questions categorized into current feeding practices, nursing training, parent education, and feeding outcomes. And then those interviews were transcribed and analyzed using in vivo to identify specific themes. The interviews were 45 minutes approximately, so this is just a quick sample of a few of the questions, really looking at all of those categories. The analysis ultimately came up with 3 major themes identified: inconsistent understanding and implementation of cue-based feeding. So there was a lot of discussion that there was inconsistent feeding methods between nurses. Some continue to use more volume-driven approaches, some use more cue-based approaches, and that is confusing for families. There's also a lack of clearly defined infant cues with operationalized definitions, which leads to more inconsistencies, especially with those subtle cues. We know that we've focused on quality over quantity as the goal, but many professionals still focus on the quantitative and forget to add in the feeding skill development components when they're talking to families. Again, that confuses them on where their priorities are. And nurses brought up that the understaffed units also result in decreased time spent with the infants and their caregivers, which really impacts their ability to educate them. Second theme that came up with this was the need for improved nursing education and support. New nurses require additional training. Oftentimes they're with one preceptor throughout their orientation period, and so they pick up the feeding method of that preceptor. The nursing supervisors had talked about wanting them to spend time with multiple nurses as well as with speech-language pathologists so that they can learn different methods and pick up all those different experiences. Experienced nurses sometimes get stuck in their old ways and need additional training as well, but time is always a factor. They're already talking about being understaffed, and then trying to take extra time to do more training with them becomes an issue. The last major theme that came out of this was the need for improved parent education and support. Parents oftentimes have difficulty identifying the cues. They are experiencing barriers in the NICU, including the high stress that they're under. Their desire just to get home and take their baby home sometimes interferes with their ability to really identify and respond appropriately to their infant's cues. And then they're sometimes getting inconsistent messages from the variety of staff. There's also barriers in terms of their ability to attend enough feedings and get that practice in and spend the time training because they may be going back to work and saving their maternity leave, or they have other children at home, things like that. So nurses and SLPs and other professionals in the ICU really need to focus on identifying their different learning styles and being supportive of those.
30 seconds, please.
Perfect. So we know there's barriers and inconsistencies related to the implementation. One of the biggest of those is that just the inconsistencies in identifying what those cues are and really what cues are the most important. So some good information, but lots more work to be done.